So as a result of rising COVID cases and deaths, Prime Minister Andrew Holness announced a 7-day no-movement period, or seven no-movement days, in an effort to contain the spread of the virus. Zooming in to give us details and his views on the lockdown and the necessity for the lockdown, occupational physician and public health specialist, Dr. Alveston Bailey. Dr. Bailey, good morning. Thank you for joining us this morning.
Good morning to you.
Good to have you. Some folks questioning the necessity of this lockdown. Your thoughts, because I believe it's something that you were calling for before the PM actually announced it. Is that so?
Yeah, absolutely. It's important for the listeners and the viewers to understand what really has been going on. What actually has informed the lockdown is what we call some epidemiologic parameters, such as death rates, bed capacity, and positivity rates. It's quite useful to actually look at the data and then that would put things in proper perspective. Let's look at death rate. In June of this year, we are looking at roughly 3.7 deaths per day. Then in July, it went up to 3.74. And after the restrictions were released, the death rates went up to over 15 to 16 persons per day. Bed capacity jumped in almost all hospitals to over 100%. And at one point in time, Savlamar Hospital was seeing a capacity of over 150%. Now, of interest, the other parameter that the government looked at was called positivity rate, which essentially is a value that looks at the total number of persons that are positive out of 100. And what we found was that the positivity rate in June was fairly low, 18%, and then it went up significantly around the 14th of August to 38%. And then to put things in proper perspective, as at yesterday, it was 44%. The other factors too was critical illness. It's important to note that earlier in the year, the critical illness was fairly low. So you find, for example, that in July, critical illness was 16. And then as at the 18th of August, it went to 36. And yesterday, it was 6. So we note that the new patients went up, the positivity rate went up, hospitalization went up, and the health system became overwhelmed. What really I found really worrying was, as at yesterday, I looked at the Ministry of Health statistics, and it actually sent a chill down my spine. And I'd like all Jamaicans to look at the statistics, because they listed 17 Jamaicans that died. The list just went on and on and on. And we are at a stage where this has to stop.
Hey, Doc, I'm sorry. I hear you talking about the positivity rate of over 40%, right? I just want us to contextualize this for folks who are watching, because I was listening to Dr. Manning on Friday, and when I heard him say that the red flag in any country is a 5% positivity rate, that's when you know things are at the worst. And when I thought about that, and I thought about our over 40%, I was like, we are in hell.
Okay, yeah, the acceptable positivity rate worldwide is 5%. The government's cutoff point many months ago, before they implemented targeted lockdowns, was actually 20%. We have gone way beyond 20, and we are now heading towards 50. What this means essentially is that almost 1 in 2 Jamaicans tested for the virus is positive. And this means that we are in an extremely severe case of community spread, and the situation has become extremely dangerous for the health and well-being of all citizens, and something fairly drastic has to be done, and that will have to be a lockdown. The government had absolutely no choice.
Having said that, sir, is it enough, the lockdown?
The 7 days.
The 7 day, and it's not 7 consecutive days. And I understand people have to earn. I understand all of that, and I understand people are suffering because they're not earning, and it's been hurt their livelihood. But is this enough, sir?
The response to the surge was quite obvious. The government had to consider enforcement, lockdown, vaccination, improving the health capacity, and aggressive contact tracing and quarantining. I'm just going to mention quickly enforcement. In a Jamaican context, enforcement is not possible with widespread civil disobedience now, with no adherence to protocols. The only way enforcement can take place is if the government, and the government has chosen not to go that route.
If the government does what, Doc? Sorry, you dropped out. You said the only way that can take place is if the government employ
trained COVID marshals, somewhat like the municipal police, with authority to fine or arrest. They have chosen not to go that route for fear of public kickback. So they went to lockdown. The lockdown that they had was predictable. They had the option to go targeted lockdowns in regions with high positivity rate or phase lockdown. And I want to dwell on the concept of phase lockdown because phase lockdown is now described as no movement days. And this actually was implemented because of the very high positivity rate, the exhaustion of bed capacity, and the death rate being greater than 10 per day. They had 3 options. I would like to run the options by the listeners and the audience to see where we're going. Option 1 was to use what I describe as the least movement days, which is Sunday, Monday, and Tuesday. If that doesn't work, they'll have to go to option 2, Tuesday, Wednesday, and Thursday. If the positivity rate and the hospitalization and the death rate continues, they'll have to go to option 3, which is Thursday, Friday, and Saturday. If all fails and the situation still remains out of hand, they'll have to go to option 4, which is total lockdown for 1 week. Those are the options that the government has.
What's the difference between a Sunday, Monday, Tuesday, a Tuesday, Wednesday, Thursday, or a Thursday, Friday, Saturday? What's the difference there?
I describe Sunday, Monday, Tuesday as low movement days, which means their economic activity is just warming up. It's fairly limited, and there's not a lot of movement. Movement increases around Wednesday as person goes to market to sell their wares. And it increases even greater around Friday and Saturday. And so as the week progresses, movements gets more and more. The government opted to go for the low movement days as a trial run to see if the citizens will cooperate, and there'll be a significant reduction in positivity, admissions, and death. But if this fails to bring us down to at least 15%, you'll have to progressively increase the lockdown until, God forbid, we have to lock down the whole country.
You think it's going to work, Doc?
Yeah.
Yes, it will work.
It will work.
It will
this
work
will
because,
work.
Yes. Yes, it will work because it is movement of people that causes the virus to spread.
So that's the point. This is my final question. Because public health, of which you are an expert, right? You're a specialist. I saw there's dialogue in social media about the fact that I just think we need to situate this for people, Dr. Bailey, because I think when we talk about the issue of public health, people don't understand that that's each of us playing a role in the situation. It's not somebody who is opting out of cancer treatment because it's experimental, or somebody who's opting out of this because your non-adherence to the protocols, your decision to not get vaccinated, although you're right, directly can potentially impact somebody else. So public health means each of us have a role. It's a group project. It's a group project, and each of us has a role to play.
In public health, we're all interdependent.
Right.
Which is why personal responsibility is important, but is not critical. In public health, your action influences others. And therefore, it's important for controls to be put in place to regulate the behavior of people so that they do not have a severe effect on others. Because your infectivity, and especially with the advent of this new Delta virus, one person can infect up to 4 or 5 others. And especially since we are not conforming to protocols, it's important for us to regulate people's behavior so that they remain at home.
So, Doc, can I ask you a question? We'll have to wrap, but after we do this and you say it will work, what do we do after that to ensure that it stays where it ought to stay? Because if we go back to what we were doing before, it's going to go right back up.
All right. The option we have after this is vaccination. We have no choice. And I have some interesting thoughts about vaccination because many persons argue about vaccine hesitancy. The target groups have always been the elderly, those with comorbidity, those with high exposure, and now children greater than 12 years. We have only vaccinated about 6% of the population so far. We need to urgently ramp up vaccination because that's the only way we'll be able to overcome this pandemic. I'm recommending that the government look at 2 methods for removing vaccine hesitancy. One of them is incentives. Incentives such as cash, lots, salary adjustments, pension fund adjustment, life insurance, stocks and bonds, hazard pay, and now face-to-face classes, which is working. The face-to-face classes as an incentive is bringing out children and parents. So incentives do work. The other option is coercion, which have been used by some countries like salary, vaccinated, lockout, and the most effective method of encouraging persons to vaccinate is to invite them to test at their own expense. Now, legislation might have to be implemented for those who really are uncooperative, especially healthcare workers, caregivers, teachers, BPO workers, taxi and bus operators, the security forces, civil servants, and bankers. The final approach we need is to get the message out. Many persons are confused, uninformed, and totally ignorant of the role of vaccines. We need to get the pastors involved, the community leaders involved, and we need to get doctors involved. The doctors have been underutilized for too long. And then we need to improve bed capacity. We need to open up the national arena. What became of that plan? We need to put in more field hospitals. Falmouth now has to be accepting patients from Westmoreland. Unacceptable. We need to put mobile oxygen concentrations in all hospitals. Why not get them? Yeah. We need more PE and we need more trained healthcare workers. This is not the time to lay off doctors. And why don't they ask GPs to help? We have thousands of GPs all over Jamaica who can help.
All right, we have to go, sir. Thank you so very, very much for speaking with us this morning. Stay safe, sir. God bless you. Thanks again. Occupational physician and public health specialist, Dr. Alveston Bailey.
Incentives, coercion, test at your own expense. Yep. Which one do we try?
Let's see. All right, on the other side of the break, we meet a 7-year-old blazing up the 1s and 2s. Stay with us. Some come.